Hello, and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio, and thank you for joining us once again. In 2020, it's estimated that nearly 18,000 new colorectal cancers will be diagnosed in people under 50. That's roughly 50 cases a day. Now, we know it's preventable if caught early, but catching it early means that people need to get screened. Joining us is Dr. Paul Limburg, gastroenterology consultant at the Mayo Clinic, and he's going to talk with us about colorectal cancer screening and some of the options that are out there. Welcome to the program, Dr. Limburg. Thanks for taking the time.
My pleasure, Neil. Happy to be with you.
Right. Well, give us a bit of your background, if you would.
So, Neil, I'm a gastroenterologist at Mayo Clinic. I also serve as the Chief Medical Officer for Screening at Exact Sciences. I've been in practice for over 25 years, and my area of focus is prevention of GI cancers, including colorectal cancer.
Now, there's a new report that's out that suggests colorectal cancer in younger adults is becoming more prevalent.
That's right, and we don't fully understand why these trends are going in the direction that they are. Through effective colorectal cancer screening, we've noticed declines in older populations over several decades with respect to the number of new colorectal cancer cases and also the number of people dying from colorectal cancer. But more recently, those trends have been reversed, and the numbers are actually increasing in persons younger than age 50 years.
So based on that, how have the guidelines for screening that we've all been so used to for many years changed?
So traditionally, we've thought that screening for colorectal cancer should begin at about age 50 if somebody is at average risk for the disease. And that's based on historical data where the numbers, the rates of the disease would tend to increase more rapidly sometime after age 50 years. But given the recent trends in both incidence and mortality, groups like the American Cancer Society have done modeling studies and looked at other data and recommended that now persons consider beginning their colorectal cancer screening at age 45 years. I think other guideline groups are also considering whether or not to lower that age to 45 years, and there's even discussion in some instances that we might want to start screening lower if people are at increased risk for the disease.
Do you think that the changing the guidelines will prompt more screening than before?
I hope so. The estimate is that there's about 19 million people that would fit into that 45 to 49-year-old age range who would be potentially eligible for colorectal cancer screening. So my perspective is, given what we are seeing with these recent trends, that it's better to get people started on their screening process as early as possible, and hopefully then we can get them engaged over a lifetime.
Are there any reasons why more people aren't getting screened based on the guidelines that we've all heard or the new guidelines? Is screening invasive? Is there some reason that people might want to put it off?
That's a great question. So talking about colorectal cancer is probably not at the top of anybody's list of preferred activities, but it is an important, potentially life-saving conversation that anyone can have with their healthcare provider. The good news about colorectal cancer screening is that there are many endorsed options, and they range from tests like colonoscopy or flexible sigmoidoscopy. These are endoscopic tests that do involve preparation prior to the exam. They are considered invasive tests, but they're done, colonoscopy is done typically with sedation, and so the exam is generally tolerated very well. There are radiologic tests that can be used for colorectal cancer screening, something called CT colonography or virtual colonoscopy is another name. That also requires a preparation prior to the exam, and some gas is inflated into the colon during the procedure through a small rectal tube. And then there are stool-based tests that can look for blood or molecular markers that may not require any preparation prior to collecting the sample. And if those tests are positive, then they would need to be followed by a diagnostic evaluation such as colonoscopy.
Now, the latter, the final option that you talked about, that last one there, is that something that needs to be done at a hospital or a doctor's facility as well?
So the nice thing about the stool tests is that they can be done at home, and the technology is such that the test can be performed off of a single sample, and then the results can be delivered to the doctor. And if the test is negative, there's no need for an invasive follow-up test. If the test is positive, a colonoscopy would be recommended to complete the screening process.
Now, being able to test at home, what type of options are we talking about? I mean,
the home-based tests would include the stool test. So there's one called a fecal immunochemical test, which tests for blood in the stool. There's an older test that also is used to test for blood in the stool called a guaiac-based fecal occult blood test. And then there's another category of stool tests that look for molecular markers and also blood, and that's called multi-target stool DNA testing. The trade name is Cologuard.
So you're in your home, you're in the comfort of your own home. How do you get someone to actually administer, to actually screen themselves? I mean, there are lots of options out there, but people don't necessarily do that. Is Cologuard any different from the others as far as adherence is concerned?
Well, we're looking at the participation rates with colorectal cancer screening in general, and then also by specific tests. And there's a recent study that we conducted with data from Exact Sciences laboratories, where we looked at a subgroup of patients who were Medicare age, Medicare eligible, and in that sample of nearly 370,000 patients, we looked at the completion rate from order for a Cologuard test to completion of that test, and we found that 71% in that population were willing to complete the test after it had been ordered. That's a very important number. We know that screening tests can only be effective if patients are willing to actually follow through and complete the test or the procedure.
So what do you think, why do you think what are some of the factors that contribute to this growth in adherence with Cologuard?
Well, it tends to be that people are interested in a less invasive option. Also, tests that can be done at home don't require going to a facility to have a procedure done. There's also differences in the interval of testing for the endorsed colorectal cancer screening options. For some of the stool-based tests, like the fecal immunochemical test, that needs to be done on an every year basis. The multi-target stool DNA test or Cologuard can be done every 3 years, and more invasive tests like colonoscopy are typically recommended on an every 10-year basis for average risk screening.
Well, where can we get some more information about Cologuard?
So the best way to get the up-to-date information and decide which screening test is right for any individual is to talk with your healthcare provider. They have up-to-date information and are aware of the colorectal cancer screening guidelines. There's also information available through websites where patients can at least start to get a sense of what these tests are, and then bring that information in to talk with their healthcare provider. Tests like Cologuard are only available through prescription, so it does involve and is aided by a conversation with a practicing clinician.
And that website would be cologuardtest.com, I do believe.
That's right.
Cologuardtest.com. All right. Well, thank you, Dr. Limburg, for joining us here on Health Professional Radio this morning. Lots of great information. And thanks for getting the word out about the importance of early screening for colorectal cancer. Thank you very much.
Absolutely, Neil. Appreciate your interest. And March is Colorectal Cancer Awareness Month, so hopefully this conversation will help people take that first step to get screened.
Without a doubt. You've been listening to Health Professional Radio. I'm your host, Neil Howard. Excuse me. Audio of this Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes or listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/healthprofessionalradio.